Welcome! The following video will help explain the medication your baby is receiving. So, if your baby has a bug or an infection, keep watching to learn more about the drug they are getting. And, as always, please let any member of your child's healthcare team know if you have any questions. You may be wondering if your child has an infection. It is common for your baby to come into contact with many bugs, meaning bacteria and or viruses, during the delivery process and during their hospital stay. Some bugs are good for us and we actually need them to keep us healthy. However, some bugs are bad and these will make us sick. If your baby comes into contact with a bad bug, then they may develop an infection which requires treatment. It is important to remember that antibiotics only work against bacteria, not viruses. So, if your baby does not have a bacterial infection, they should not be on these medications. There are also many types of bacteria in our body, and not all of the antibiotics will treat every single type of bacteria. Therefore, the antibiotic chosen by your doctor was selected based on the type of bacteria we think or know is causing the infection your baby currently has. So why is your baby on antibiotics? Antibiotics may be started if your baby is suspected to have an infection during their hospital stay. We may also draw a blood test at this time to determine what kind of bacteria your baby has, and so that we can select the best antibiotics to best cover that specific bacteria and make your baby better.
So what antibiotic is your baby on? Your baby is on a medication that belongs to the class of antibiotics referred to as cephalosporins. Cephalosporin antibiotics are a group of antibiotics. There are many cephalosporin antibiotics that all belong to this class. Although they are all in the same family of medication, each one can act a little differently. Examples of cephalosporin antibiotics include cefazolin, cefotaxime, ceftazidime, and cefepime. Your baby may be on any of these medications. So why is your baby on a cephalosporin? This class of antibiotics provides very broad IV antibiotic coverage to a wide variety of bacteria that can cause infection in neonates. These bacteria may cause infections in the brain, blood, lungs, and even urine. Now, as a parent, we know that you are concerned about the side effects of these medications. However, the chance of your baby developing an adverse effect is rare. Some side effects that may occur include diarrhea and or skin rash. But do not fear. We will be watching your infant very closely to make sure that they are doing okay and to limit the side effects which may occur.
You are also probably overwhelmed by everything that is going on with your baby and wondering what you can do for your child. We encourage all parents to ask lots of questions. Some important questions we encourage you to ask are why your baby is on the medications they are on. We also encourage you to stay involved and ask whatever questions you may have that arise. Remember, no question is a bad question. The more you know, the better you will feel. You may also ask how long your baby will be on these antibiotics. Because antibiotics may be started for many reasons, the amount of time your baby is given the medication may vary. If the doctor thinks your baby is at risk for an infection, they may start antibiotics empirically. This means we will start antibiotics to be safe, but we have not yet confirmed or found a specific bacteria which is making your baby sick. Your baby may just be on this antibiotic for a few days to rule out the infection. However, if we know your baby has an infection, these medications will be continued until the infection is completely gone and your baby is once again healthy. Thank you for your attention. Remember to ask your doctors, nurses, and pharmacists about any questions you may have regarding your baby's medication or treatment during the hospital stay. Thank you for allowing us to care for your child. Best wishes!